Hello and welcome to another one of our videos. I'm going to try and keep this one pretty quick because it could go for 2 hours otherwise. Basically I'm going to try and explain how hip stiffness can be the real problem with back and knee pain, and actually potentially nearly any other joint, but especially the joints above and below. So I'm going to get into it. Often this is the missing link in these are the most 3 common injuries we see. Back pain would be the most common, then closely followed by knee, and then also shoulder. All of them are influenced by the hips in a big way, especially, like I said, the back and the knee. But yet often the hips are the undetected when you're being diagnosed, and especially in the treatment, which is really bad because the thing that is actually the real problem is just left to continue working in the background while you're just more or less treating your symptoms. So I'm going to explain to you how this happens, and then give you some ideas on how you can go about correcting it. All right, so how do you get stiff hips, tight hips in the first place? Well, sitting is by far the biggest cause. So, have a look at the evolution. We sort of evolved to standing, and now with our sedentary lifestyle, we're sitting all the time. So we're basically holding our hip in permanent flexion, and those muscles sort of just with time just stiffen up with being in constant contraction. We just don't stand up enough and move it around, and definitely a lot of people just don't do any corrective exercise to try and negate that. Other things that influence it: poor footwear. So as you'll see in a second, the ankle, the feet can also play a role in stiffening the hip up. Poor running form, poor training techniques in the gym, very common. So you might be going to the gym to correct your problem, and now you exacerbate it instead of fixing it. Occupation, so a lot of occupations require you to sit down or use repetitive movements. A lot of sports have a lot of repetitive hip actions. Even yoga, which is a lot of people regard as the ultimate in correcting these, and Pilates can actually excessively stretch it, so they go too far the other way. Which ironically also creates problems, as you'll see shortly. Previous injuries can also set the wheels in motion. So how does it? What happens why do the hips get tight? Well, for starters, you have to understand that muscles are sort of broken into 2 sort of phases, and you can refer to the book here. Vladimir Yanda's, he's like the godfather of treating muscle imbalance. Shirley Sarman's stuff is very good as well. But basically, this is where the terms lower cross and upper cross syndromes were coined, and this is where the tonic and phasic muscles were also given their names as such. And basically, tonic muscles, being like the hip flexors is one of them, very much prone to tightness and shortness. And the phasic, which are the opposite to that, are prone to weakness or inhibition, meaning that they're sort of prevented from working as the tonic guys steal their work. This happens when there's you've either had a traumatic accident, or there's dysfunctional movement present, so from your faulty footwear, or something that's creating instability. So sitting all day, creating shortening of the hip flexors, now creates a dysfunctional movement, which then sets off the wheels in motion of making the hip flexors work with every movement, when they should actually be only assisting but not being the dominant muscle. And the guys being the phasic ones do the exact opposite. So this basically, the body adapts to the feedback and just creates a new stability because it feels like it's unstable. So the new stability term is basically stiffness. So the hips get tighter because the phasic muscles, being the glutes, are getting weaker and not assisting the hip in staying stable. Someone has to go in and do the job, and the hips put their hands up and say, let's us do it. Another good book to read is this one here by John Gibbons, The Vital Glutes. It goes into a lot of detail about this as well. I suggest getting a copy of that if you want to know more about what I've just explained there. Okay, so now that you've got your stiff hips, you're going to have 2 problems. All right, so firstly, you're going to prevent getting full range. So you can see this guy doing a depth. This is a perfect way to get a herniated disc bulge, slip disc, whatever you want to call it. It's the same thing, but if you want to get a severe back injury, that's exactly how to do it. But it's not because this guy may not be able to get his back in the right position because his hips aren't able to do the work. A lot of people think it's hamstrings, but it's 90% of the time it's the hips that can't actually get into the anterior tilt position. again, from stiffening up, from instability, that creates the weak hams or the tight hamstrings. The hamstrings are actually needing to become that tight to actually provide his stability when he stands up. So if you stretched his hamstrings, you just make him more unstable. Now, the other problem you're going to have is the weak glutes, because you can't get in the correct position to actually do the lift. So, these two things are sort of making the problem speed up into a bigger problem. Piriformis syndrome, by the way, is very much accompanied with this weak glutes, and there's very much a big factor with piriformis syndrome is the stiff hips come, and then the weak glutes come second. Then the piriformis muscle, the little tiny guy that sits underneath the big guys, starts overworking like the hip flexors, because he's also a tonic muscle. Now you're going to have a huge problem, because he's going to start touching that sciatic nerve, and that's when you get sciatica and all those awful things like that. So once it's there, it's very hard to get rid of. Not impossible, but very difficult to get rid of. So the best thing is to prevent it in the first place. Okay, so there's getting your compensatory movement. Unable to provide the necessary mobility, so just everyday tasks like picking up leaves. You're forcing other joints to find the mobility that you don't have at the hips. So that's where you start to see the lower back bend and flex, because the hips are not moving enough. All right, so because they don't have enough mobility to shift backwards, you're going to have a problem at the lumbar spine, but you're also going to have a problem at the knee. So see what I mean? Like the two joints above and below are going to be the ones affected, because the stiffness in the hips will force you to find it somewhere else, even though it's less than ideal. So the two joints, the knee and the lumbar spine, really need to be very stiff. They don't need the mobility. They can't do it. They're more or less just a hinge joint. Then you start to see the energy leak. So if you're playing sports, this is where the shoulder becomes a problem, because you don't have the glutes and the hip mobility to drive the throwing action. If you're a baseball player, for example, or a tennis player, any sort of throwing sport for that matter, you're going to have an energy leak, and now you're going to risk throwing your arm out and creating a shoulder injury because you don't have it. You also, if you're say playing soccer, it's where you get the energy leak in the down lower, because the hips don't get you in the correct position. You're trying to find the mobility through the knee, and that's where you see ACL injuries and all that sort of stuff. So basically you have to find where the leak's coming from, otherwise your back and your knee are going to suffer. So I'm going to show you a couple of examples of what that looks like with real life, one real life case study and another one where we demonstrate what happens when there's an issue going on at the hips there.
Alright, so let's have a look. Alright, so you can see why I didn't want her to do too many of them. Alright, so as she lands, see how this knee just rolls right in. That's quite exaggerated, but again, I have seen some instances where people do this sort of a movement and they're not aware of it at all. That is where you are going to really do some serious damage if you do enough of those. Alright, and see how her body's too upright, she doesn't land with her butt behind her. Here's a client that basically this guy's had a massive hip dysfunction that's just pretty much disrupting all of his system with every movement really that we teach him. But you can see here his initiation, the very first thing of the movement, you can tell he's all arms, because you can see most of everything that's moving is arms. It's like a big bicep flex, and then he's trying to muscle it up with his arms, and really just got no movement from his legs, especially the right leg. He gets down in a bit of a squat there, but there's no transfer of weight. You see how his hip is sort of like just staying stuck on the spot here. So this leg here, if you watch this as it continues, he just sort of really doesn't go anywhere with it, just goes straight up. At that time you sort of come around a bit, but there's no real transfer to the other leg. And even there he's starting to fall out. Really his centre of gravity is still, he's already on the other side, he's already over there. If I play the video of his first one, okay, so we've just seen that's what he does. That's his pattern, and we showed him the video. We did a few exercises, a few stretches, showed him what we wanted him to do. Bearing in mind that it's almost impossible to learn it that fast, but with a bit more of awareness, he was able to sacrificed a bit of his range and maintained his posture a lot better. However,
All right, so I hope you enjoyed those. Now, the three movements that your hip must provide to ensure that those things don't happen. Firstly, if you're rotational, and you need like good rotational mobility for throwing sports like tennis and baseball and so forth. You need the hip hinge. So in this case, the hips have got to be driving this rotation, so the lumbar spine doesn't try and do it. Then it's got to be able to drive this extension, which you would see for lifting stuff. But you will also see hip extension used in walking, because this is when this leg has got to push behind you to make you go forward. So and that's what we call hip separation. So the hips are sort of separating each other. So it's hip extension here, hip extension here. This one just has hip separation as well. So some people have this good, but they don't have that good, and vice versa. All right. So there's three things you must be able to do, and if they don't do it, again, you're going to have problems at the knee or the back, and possibly somewhere else. So if we're looking at the knees, the hips are too stiff, you're unable to recruit the glutes. The glutes keep the legs aligned in the perfect alignment. So you see this guy here, terrible alignment. He's got no glute control at all, possibly no good ankle control. Which one started is hard to say. So I put a picture here where, say if it was the ankle pronates, brings the knee in, because it's falling in, it's pronating excessively too much. Now you're going to get a hip problem, and the pelvis is tipping forward. So it could have been 1, 2, 3, 4, or it could be 1, 2, 3, 4. Regardless of which one is starting it, now you're going to still have the problem of trying to correct it anyway. Again, this is where we see all the ACL, patella tracking, ITB friction, plantar fasciitis. All these things are all linked to this problem, and 9 times out of 10, it's the hips and the ankle driving the problem here. All right, so that's an example of like what hip stiffness looks like for the knees. So if we look at the back, so as we saw the guy before, we know that you've got the weak glutes, but you can't get that pelvis to tilt forward to give you the anterior tilt that you need to keep the spine in its neutral position. So there's just no other way you can lift it other than to flexing your back, because your hips are not going to move for you. So you're just going to blow your back out, or don't lift it. These are your two choices until you work out how to correct this problem here. Excessive anterior tilt, so when the hips are driven too far forward. So the opposite of this, so if the guy's too far, you're also going to have trouble, because now you're going to compress the spine. So that's when you lock up facet joints, you get sacroiliac pain. You see the piriformis syndrome kicking in here. So too much flexing of the back and too much extension of the back, because you can't actually get the hips to do what they're supposed to do. All right, so that's where you start to really stuff the back right up. So on top of all this, there's a good chance you can also develop osteoarthritis and other things, like we said, the piriformis syndrome, because the hips are now going to really become a chronic condition, and now you're going to start having problems with walking, and eventually that leads to disability. So and surgery is not really a great option, because it's just really treating the symptom and not the original reason you got the problem in the first place. So what can you do? Well, stretch it? Well, not necessarily, and definitely don't do this. So this isn't necessarily a good thing, all right? That's really gonna, as you'll see, this is what we call hypermobile. Even though it looks impressive, this creates massive instability. If this person's got no pain, good for her, but I wouldn't recommend copying that. She just maybe genetically that way, but as you'll see, a lot of people that have this end up having instability as they age, and get chronic arthritic problems from being too flexible. All right, so first thing is you've got to eliminate your source of your problem. So if you're sitting too much, you've got to start finding a way to stand up more often, stretch throughout the day, to have lots of breaks every 10 minutes or so. If it's from your sport, you might need to have a better corrective strategy in place, or your job, so forth. Whatever your source of your problem is, you've got to eliminate it. All the corrective stuff won't work if you've still got the thing running and that started it all off. Assess your flexibility and address any range of motion deficits. So if you've got a flexibility problem, you want to find out if you have. If you've got one, then you need to stretch it. If you don't have one, don't stretch it. You'll need to strengthen your stabilizers around your inner unit, so your diaphragm and or your transverse abdominis, your deep abdominal muscles. You need to strengthen your glutes, your hamstrings, so the posterior chain we call that. You're going to definitely need to move correctly, because so far this hasn't addressed movement. So you might have all of these three things but move terribly. So that just sort of puts you back to instability again and wipes all them out. And you must strengthen that right at the end, like with the deadlifts and single leg squats are the key, but many other ones as well. But they're really the big important ones that work on the hip extension, hip separation, and gluteal control in the sideways movement. So it addresses all of the back and knee problems really within 2 exercises. There's a lot more to it than that, but to give you an idea, that'd be the idea. So stretching, like I said, may make matters worse. Assess your body first. If your hip range of motion is fine, then you have a stability problem, not a mobility problem, and don't stretch. So stretching more will just make you unstable and stiff when you stand up. So the girl in this picture here does not have a mobility problem. We're testing her, she's fine. She would not want to stretch. She would want to just learn how to stabilise and strengthen. And that's how she'll resolve her problems. And actually, this is a real life client who had a knee problem, very much from instability and lack of strength and poor movement. But that was really all we did. We didn't do any stretching with her at all to address her problem. Stability. So a good quote here: tight muscles show themselves lying down and the weak ones will show themselves standing up. So you won't be able to assess stability in a lying down position. You'll have to do it standing up, and that's when you see this problem happen. So this guy might have perfectly good mobility on the floor, but when he stands up he looks stiff as a board. So you'll have to, and as with this is terrible, I think this is exaggerated, but that gives you an idea. So again, start with your inner unit drills first, so make sure you've got some basic stuff, but you've got to learn how to get up into the standing position, assess your glutes, simple exercises before harder ones, so clams, hip extensions, etc., and progressing to the more integrated ones with reflex timings, so going from kneeling to standing. There's your basic clams and hip extensions for glute control there, but you know, these things are going to be much better, and even the single leg squat itself is a great stability assessment exercise. Alright, so there's your stability stuff. There's a lot more stuff I'll have for you in a minute. Strength, as I mentioned before, there's a lot of things to this that you really need to do, but deadlifts would be the best one. These are both deadlifts. It's a single leg and a double leg. I would regard this one, I'll try to get better at this one before that one. They're both important, you need them both, but this one's a lot more difficult to control, a lot more gluteal control in this one than that one. And then also learning how to lunge, especially in all directions, so you get the adductors loosened up, because they'll tighten up in line with the hip flexors. All right, so learning how to move correctly and doing all those things is very, very important. So you'll also need to not disregard all of the other patterns. So you'll need to learn all of the patterns of movement, because one of these patterns, if you have a problem with a squat, it can affect the bending and the lunging. So you need to really learn them all. You can't just go to the one that you've got trouble with. They must all be good. You must also look at all of the different joints. So you can't disregard what's going on at the ankle and the foot and the knee, as we saw earlier. So every second joint's going to need a different role. Some need mobility, some need stability. You can get a free report from my website that gives you a lot of ideas on how to break this up for all these patterns. I break it down into different, so I'll give you 3 different programs, so like an easier, a harder, and a hardest. And that'll give you a good idea on how you actually do that and learn how to move correctly and get stability at all these joints where you need it. If you do have problems with knees, then this is by far our best program for that. Piriformis syndrome, very much a hip related problem, so this is probably the most relevant to this video, but again, we see these 2 injuries probably more so than this one, even though this one's more of a hip problem. So can you see how they're all relevant to each other? So you can go to our online shop to get these. There's plenty of articles on our website that'll give you stacks of ways on how to go about correcting this very difficult and painful problem. Alright, so I hope you enjoyed that, and I'll see you on our next video.